Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Hope you're all well and enjoying the great weather. My name is Dr. Gil Lederman, and we're here on the Radiosurgery Hour talking about ways to have a better life for you, your friends, your family, better things to do to have a better life, cancer treatment, and that's what we mainly do. We're a cancer treatment center. We treat people with cancer or people with masses. We often treat new patients who come with a mass in the breast or the neck. We had several calls overnight even about what to do with masses in different parts of the body. And yes, we take care of new patients with cancer and those who have recurrent cancer whose treatment is lousy. Simple word, lousy. We're live, and we're live at the WOR studios with Bob and Ed, so they're running the controls. If you have questions, you can call us at 1-800-321-0710, 800-321-0710. I want to get into the matters right now. Let's not waste any time. The first patient I want to talk about is a man who came, he's actually from Eastern Europe. He's been in the United States about 10, 15 years. This is the beauty of America. He's with his friend who translates for him. I think he speaks Czech or one of those languages. And he has metastatic prostate cancer. He came to me with a big mass in his head, in his skull, from prostate cancer. And this mass was very painful, very symptomatic, and came last year for treatment. We used radiosurgery for this mass. Radiosurgery is focused beams to hit the cancer and not hurt healthy tissues. He had 5 treatments. That's the beauty of our treatment compared to others. 5 treatments. Each one takes about 15 minutes. Came in, get his treatment, went back to work. Was able to work fully. He's working to this day. We treated that mass. The pain went away. The mass went away. He had 2 other spots causing painful symptoms, one in the hip and one in the back. We treated them. Again, 5 treatments, 15 minutes each. And guess what? He came in on Friday, just 2 days ago. He got restaged, and that cancer is gone. The pain is gone. He's in remission, doing great. So that's the point of our treatment. We don't like to do months and years of chemo if you can avoid it. We believe for many patients, not every patient, but for many patients, they can benefit from radiosurgery. Who's the experts? Well, we are. We brought stereotactic body radiosurgery to America. So if you want to know about it, who should you speak to? Well, you should speak to, I believe, the people who know the most about it. Now, a lot of people say, I'm going to go to my doctor and ask him what he thinks. Well, look, if he knew about it, he would send you, but he hasn't sent you, so it doesn't really help to ask someone that doesn't have much experience. And that's why we always tell people, get a fresh second opinion. Get some fresh eyes, some fresh thoughts, some fresh brain cells on your case to try to help you and your case get better. At least hear about it. We think you should come in and meet. We won't cheat you with time. Sometimes I thought doctors cheat patients by not giving them enough time, and I think that's often true. But sometimes patients cheat themselves. Sometimes patients call up and ask, "Oh, doc, just tell me what you do." But the problem with that is that often patients don't know the critical facts. They don't know about the pathology. We have patients that sometimes don't even know what kind of cancer they have, or if they have cancer. And they've never seen their reports, and they never have seen their images. Here, we give you reports, we give you your pathology, we give you your images, so you can go home and look at it yourself. You can read over about you and learn about you. So we think that the patient who's prepared will get better care and will be able to ask the better questions and review the pathology and know what's going on. And that's the way to have the best possible care. From the Good News Department, and that first patient was actually from the Good News Department. The second patient also is from the Good News Department. This is a 60-year-old woman, was born in Russia, came to the United States 20 years ago. She's working, hard-working. She has a benign tumor in the brain called an acoustic neuroma. And I saw her a couple years ago, and she just was reluctant to be treated with anything. Well, acoustic neuromas are tumors around the 8th cranial nerve. They cause hearing loss and dizziness. And then her face started getting twitching and weak. So the tumor, even though it's a benign tumor, was growing around the nerves, the facial nerve, which is the 7th nerve, the trigeminal nerve, causing numbness of the face. It kept getting worse and worse and worse. And all of a sudden she started going out on dates. She was divorced and wanted to go on dates, and she'd go with her boyfriend, and her face was twitching, and she couldn't hear, and it was embarrassing. So what caused her to get treatment? It wasn't the tumor. It wasn't me talking to her. It was finally that she was embarrassed to be with her boyfriend when her face was twitching and she was getting worse and worse hearing. Finally, a year after we met, she came in for treatment, which was last year. We treated her with brain radiosurgery, 5 treatments, 15 minutes in her office, went back to work each day, no side effects. And guess what? She also was in my office Friday, doing better. She's in remission. The tumor is smaller. The facial twitching is stopped. Her hearing is better. She's fully intact. She is so happy. She wondered why she waited. Well, I wondered why she waited too. I kind of knew that she was afraid. But now she thinks it was so silly to wait. And she actually got worse before she came in to get treatment and get better. So she's in remission from an acoustic neuroma. No cutting, no bleeding, better hearing, face is better, no side effects. She's dating that guy, and everything is bliss in her household. Thank God. I have another woman who came in. Wow. An interesting case. 65 years old. She has 2 sons. One's a pharmacist. She has a brother or a husband. Everyone's involved in her case. She had stage 4 endometrial cancer. So the endometrium is the lining of the uterus. It's that part of the uterus that is sloughed each month. So when a woman has menstruation, it's actually the lining of the uterus that's coming out. That lining of the uterus prepares for a fertilized egg each month. And if it gets fertilized, obviously the woman is pregnant. If she doesn't get pregnant, that lining just comes out, and there's a new lining that's made every month for all those years that women have menstruation. So she developed a cancer of that lining called the endometrium. Remember, most of the uterus is a muscle that pushes the baby out, but the lining is the lining that nourishes the fertilized egg. So she had vaginal bleeding. She had abnormal vaginal bleeding, which is a sign of cancer. So if any of you listeners have abnormal vaginal bleeding, please give us a call or see your gynecologist. It's not normal. She had endometrial cancer and went to that big hospital. There's full-page ads. It says how great they are. She had surgery and chemo and standard radiation there. And the cancer came roaring back, and she's been having chemo for the last 9 months. And while she's getting chemo, she's getting worse and worse and worse. And finally this week she came in, and she's been seeing our doctor, so they should know what's going on. I sat with her and her brother and her husband, with her son on the phone. And what concerned me was the fact that she got this chemo while she was getting worse and worse and worse. And she was getting new symptoms. She lost 20 pounds. She was pale. She was weak. And when I spoke to her about her condition, she told me that she had numbness under her eye. Well, to me, that numbness under the eye or any new neurologic symptoms are worrisome. It suggests the cancer is growing. To her other doctors, they just kept giving her chemo and chemo and chemo. It was a little sad. So we sent her for a test. I like to get people staged up so we know exactly where the cancer is. We did a special test on her brain called an MRI with contrast, no radiation, half-hour test, because I was concerned that there was a nodule of cancer that was pinching off that nerve, the trigeminal nerve, that would make her face numb. So we went to a great place, a great radiology place. They saw the scan, and the first radiologist told me it's pristine. And then the second doctor told me it's pristine. I said, it can't be. I don't believe it. Let's look at it again. Let's get a third doctor. So we got a third doctor. And that's the advantage of having your own private doctor fighting for you. Not just reading the paper, say you're okay. If I had read the paper, I would have said she's okay. But I don't believe it. So I went back and forth with the first radiologist, back and forth with the second radiologist, back and forth with the third radiologist. And finally, they all got together. I told them where to look. I told them it's the right side, the trigeminal nerve, the branch below the eye. And guess what? That's right. The nodule of cancer was there. We found it. We put her on medicine to relieve the suffocation of that nerve, and the patient and her family agreed to focused beam treatment, brain radiosurgery, fractionated with no screws, no cutting, no hospital stay, 5 treatments to hit that tumor that's pinching off the nerve that's going to the face. And that's what we're doing. And this just happened. So she's having her first treatment now. So that's the advantage of having a relationship with a doctor who's willing to fight for you, who's willing to contact the first and second and third radiologist until it's clear what's going on. Because I believe the patient. I think the patient can say a lot if they're only given the chance. Well, the other thing that's shocking on this patient is not only was she losing 20 pounds, but she had intractable pain in her abdomen from this cancer, and they were just giving her chemo that wasn't working. Her face was getting worse. The nerves were getting worse. The pain was getting worse. The cancer was growing through the liver, getting worse. Her liver was failing, and they were just giving more chemo. Chemo. Does it make sense? I don't think so. So we staged up her body just like we staged up the brain, and we found the cancer in the body, in the liver mainly, and our goal is to shrink that cancer and get her out of pain. We don't think you have to be on narcotics for the rest of your life. And she had a lot of problems with the narcotics. She was constipated. She didn't feel right. She was in pain. She was losing weight. It wasn't working. So this is symbolic of the kinds of things that we do at Radiosurgery New York. This is Dr. Lederman. And what's incredible is after we went through this whole thing, the family said, but should she have more topotecan? The doctors at XYZ Hospital want to give her new chemo tomorrow, topotecan. I said, look, she's had all these chemos for 9 months. None have worked. The likelihood of topotecan helping her as the cancer is growing, as all that chemo has made the cancer more resistant to chemotherapy, the likelihood of Topotecan now, as her liver is failing, she's in pain, it's gone to the